Hello, I am Dr. Raktim and I am here to discuss a very important topic of international health regulations, IHR. This topic of international health regulations was set up in the year 1969, and after the COVID-19 pandemic of 2019, it grew into importance. There were many amendments and reforms under international health regulations, and thus it is now of a important topic to discuss and know how the regulations of public health emergencies in the world is taken place. Without much further delay, let us go on to the topic. Before international health regulation came up, there was international sanitary regulations in the year 1951. This was the document of World Health Organization where it laid the foundation for international health regulations. The international sanitary regulations mainly concerned with 6 diseases across the globe. Those 6 diseases were cholera, plague, relapsing fever, smallpox, typhus, and yellow fever. What was the need of these international sanitary regulations? The need was to notify all the cases of these 6 diseases across the globe. Where is it happening? Why is it happening? And how is the mode of transmission? And ultimately, how much is the burden of the disease? And what preventive and control measures can be taken to uh, confine this disease outbreak or spread. That was the main motto behind International Sanitary Regulations of 1951. Based on this document, the WHO came up with the International Health Regulations in the year 1969. And out of these 6 diseases that were covered under international sanitary regulations, the international health regulations had 4 diseases. Those were cholera, yellow fever, plague, and smallpox. Numerous amendments have taken place after 1969, and um, in those amendments, it has been extensively discussed about what are the diseases to be covered, how the diseases control and preventive measures can be taken. And finally, in 1981, the main focus of international health regulations were on 3 diseases. Those were cholera, yellow fever, and plague. The smallpox was omitted by the year 1981 because it was eradicated from the world by then. So, after 1981, the main focus was on these 3 diseases only. Like I said, what they did mainly to estimate the burden of these diseases. How is it transmitting? Why is it transmitting? What is the source? What is the mode? And what preventive and control measures can be taken to confine these diseases? Moving forward to why such reform was needed. The reasons were there was increasing international trade and travel. By the year 1981 and after that, the international trade and travel was extensive. There was emergence, re-emergence, and international spread of diseases. These were the 2 main reasons of the reform. And finally, the latest reform, what has it included? Like I said, previously only 3 diseases were focused on. But in the latest amendments and reform of international health regulations, the IHR was extended to cover all public health risks that affect human health. It may be biological, it may be chemical, radiological, or nuclear in origin. Those events, not only the communicable diseases, it may be anything. It may be of biological warfare, it may be of chemical origin, radiological origin, or nuclear. Whatever it is, whatever event that is happening across the globe, which may have public health risk and that affects human health and has the potential to cover a vast geographical area, then all those events were being notified. That was the latest reform of international health regulations. It was not confined to communicable diseases. Before going to the next slide, let us go on to this image. How international health regulation works. The international health regulations is actually a multidisciplinary, multi-sectoral and multi-stakeholders approach. Why I am saying? Because a lot of ministries, a lot of sectors, both in the field of public health sectors and other sectors, are concerned with this. It requires a multi-stakeholder team approach. Then comes, after all such notifications and reforms, the enforcement of rule take place. It is directly under the governance of Director General of WHO. Whether that event is a public health concern or not, that is decided after certain steps, and enforcement of rules is take place. So all the multi-stakeholders and multidisciplinary team are accountable for their actions. If one single team or discipline misses the opportunity, then the whole framework of international health regulations jeopardize. Thus, it's a collaborative team approach, and the work done by all the teams is accountable. There need a participation of all the stakeholders together so that preventive and control measures of a disease can be effectively take place in the specified population. That was all about international health regulation in a nutshell, that how it works. We will be discussing it in subsequent slides. Let us move forward. About the obligations of international health regulations. Like I said briefly, it is to notify all events to World Health Organization on the basis of a defined criteria. Whether that event which is being notified is a can constitute a public health emergency of international concern or not. Please remember this term, public health emergency of international concern. If you are asked about international health regulation or public health emergency of international concern, uh, you may refer to these slides. And whenever an event is notified to WHO that this event may constitute a public health emergency for international concern, then what WHO does? WHO is obliged to request a verification of these events, whether actually such and such events are happening and whether it is a matter of concern that it may turn out to be an public health emergency. So that verification is done by WHO, and what it does, the state parties are obliged to inform the significant evidence of public health risks outside their territory also that causes international disease spread. Apart from notifying the specified and concerned events in their jurisdiction, sometimes what happens, the state parties are also asked to inform the significant events that are taking place outside their jurisdiction if that event is a matter of public health risk, so that international health regulations can be applied beforehand and the disease may be contained early. Moving forward to the obligations again, this notification This notification by a local authority is made to the National International Health Regulation focal point. All this international health regulation focal point is established in the 6 regions of World Health Organizations. The main task is to communicate with the local authorities and establish a effective communication network between the countries and the WHO so that no event gets unnoticed if it is a matter of public health emergency and concern. These IHR provisions for public health measures are taken up in the special entry points like international traffic entry points of airports, seaports, okay, international travel routes by road network. So all such points are the main focal points where these IHR provisions are being employed. I have already mentioned that the Director General of WHO has the authority to declare an event to be a cause of public health emergency of international concern to prevent the international spread of diseases. It is the power lies only on the Director General of WHO. No other person has the power to declare a public health emergency of international concern. Moving forward to the notification requirement. See, in the beginning of international health regulation, there were 4 diseases: cholera, yellow fever, plague, and smallpox. After 1981, the smallpox was removed. After the latest amendments, currently no longer required to notify the cases of cholera, plague, and yellow fever in the weekly epidemiological report. In this weekly epidemiological record, previously all the cases of cholera, plague, and yellow fever were notified across the globe, whether why it is happening, where it is happening, all the details. What is the age and sex distribution, what is the geographical region distribution, and all. But now, in their weekly epidemiological record, uh, these 3 is no longer mandatorily notified. Rather, what is being done is all such events that may pose to be a public health emergency of international concern, those events are notified. That may be of yellow fever in a very exotic place. Like if you get a case of yellow fever in India, then it is notified and it turns out to be an emergency for Indian scenario. It is not for global concern, it is for Indian scenario. That is the reason that these 3 cases are no longer required to notify routinely, which was done before. Now, all such events that have public health emergency of international concern are notified to WHO, thus expanding its scope and no event gets unnoticed. That is the main reason. The last bullet point explains this. All events that have serious and international consequences are notified to prevent them at source. Early intervention can be taken to halt that event to be a pandemic. That is the main motto of notification. Moving forward to the next slide now. How the assessment and notification of events is done. I said that the state parties across the country have the role in notifying a certain event to the national IHR focal point. Okay, how is it done? The state parties report all such urgent events within 48 hours. Do remember this time period, within 48 hours, by applying the decision instrument criteria. What is decision instrument criteria? We will be discussing it in subsequent slides. But for now, do remember that the state parties have this authority of reporting an urgent events, and they are obliged to do it within 48 hours to the national IHR focal point. by applying this decision instrument criteria. What the decision instrument criteria? This tool helps in deciding whether or not the specified event is to be notified to WHO under the IHR. Please remember that decision instrument criteria is applied by the state parties to specify an event under IHR only. That event, if it does not meet the decision instrument criteria, then also it may be notified to WHO but not under IHR. If it is under IHR, that means International Health Regulation, then the further proceedings is taken up in a very quick manner, so that any public health emergency of international concern may be an issue with that. So this decision instrument criteria helps in deciding whether an event is to be notified to WHO under IHR or not. This is very important. If this tool says that it is notifiable under IHR, then this notification should be done within 24 hours to WHO. Firstly, the state parties gets time of 48 hours by applying this decision instrument criteria, and after getting this decision instrument criteria says that this event is to be notified to WHO under IHR, then it is the responsibility of the national IHR focal point to notify it to WHO within 24 hours. Moving forward to the details, how it is notified, what are the points to be included in the notification to WHO. Firstly, a detailed public health information of the event is to be done. It is by the age, sex, place, time, person distribution. Okay. A detailed case definition is to be done and included in their notification. The laboratory results, the number of cases, deaths, who all are affected, why they are affected, all such information is to be included in their notification to WHO. Now, let us discuss something about the decision criteria. On what basis the state parties uh, give that event is to be notified under IHR or not. The decision criteria, there are only 4 points, okay, and out of these 4 points, at least 2 points, if it is being satisfied, then we will call it as a that decision criteria is fulfilled and it should be notified under IHR. Please remember, it should be more than equal to 2 out of 4. And what are these 4? Number 1 is seriousness and public health impact of the event. If the event that is to be notified, the seriousness and public health impact is measured by the state parties. Number 1. Number 2, if the nature of the event is unusual, then also it comes under the decision criteria. Number 3, whether that event has the risk of international disease spread, then also it comes under the decision criteria. And risk that trade and travel restrictions can be imposed if it is a matter of concern. The very latest example is the COVID-19. See, when COVID-19 was there, later on it was of public health importance, public health emergency of international concern, because the seriousness and public health impact, we all know. We know that it had a very high R naught. That means the transmission of COVID-19 was very high among the public, and it had significant public health impact. The life was jeopardized, so it fulfilled the first criteria, and it was unusual because uh, the COVID-19 virus was very unusual to the whole world, and so the unusual nature of the event criteria is also being fulfilled. Number 3, it had the risk of international disease spread because it was airborne and the transmissibility was very high. So all the persons who were in contact were uh, uh, were the sufferers of COVID-19, and it had the risk of international disease. It started with China and it covered the entire world. Okay, and the number fourth is there was travel and trade restrictions being imposed by all the countries. So all the criteria of decision tree was fulfilled, and thus the COVID-19 was declared to be a public health emergency of international concern. So this slide gives us all what I have told, that at least two out of the four decision criteria is to be fulfilled to call an event to be a public health emergency of international concern. And when a public health emergency of international concern is declared, it is the responsibility of WHO to coordinate with the affected country and the other countries for immediate response. That what are the public health measures to be taken to confine that particular event. Okay, here comes the role of team approach, okay, team building, proper coordination, and early identification and prompt uh, uh, measures uh, to confine the disease outbreak or an emergency or the confine the event. Here, what may be the immediate response? Number one, there may be enhanced screening at all the entry points. Like I said, the IHR regulations are being strictly employed in the points of entry, like the airports, the seaports. Okay, then health declaration to travelers is also being given by the after WHO declares it to be a PHEIC. Okay, surveillance and rapid response is the immediate response, and there may be travel restrictions from one place to other. High alert level is given in the global to maintain the global health. Okay, and various declarations and regulations is being given by WHO to the respective countries. Okay, now moving forward, what if the event do not meet the IHR criteria? When I say do not meet the IHR criteria means out of those four points of decision instrument criteria, at least two means not even two, only one criteria is fulfilled. Okay, then we will not call that event for notification under IHR. So what may be the reasons of do not meeting the IHR criteria? Number one, when the events have insufficient information, we will have insufficient information at the initial stage. So the decision criteria tool is incomplete at the initial assessment, and thus we may not have sufficient information to declare it under IHR. Okay, we may not have proper information regarding the laboratory results. We may not have proper information regarding the age, sex, and geographical area wise distribution of the cases. Okay, so in the beginning stage, this may not be notified under IHR, but there is a provision. What provision IHR gives you? IHR gives you provision of consultation process. This consultation process, what it happens? In consultation process, it is the responsibility of the state parties and the national IHR focal point of the respective zones, and it gives an opportunity to keep WHO informed, notified, and ensure confidential dialogue with regarding the event. Regarding the event, all such activities and latest um, latest things are being identified and notified to the WHO. The event assessment is taken place. The health response measures are taken by the state parties and the national IHR focal point, and WHO then gives their uh, requisite guidelines to contain that particular event. So this consultation process is very much important, okay, because it gives a direct dialogue communication with WHO, what to identify the best step to prevent and control the havoc of that event. Moving forward now, that how event communication take place. We are constantly saying that this event communication is taken up to the WHO at the national level. So I have mentioned it briefly that this event communication is done by national international health regulation focal points to WHO contact point. And these contact points are established in each of the WHO's 6 regions. Okay, so it is the responsibility of the national IHR focal point to directly communicate with WHO contact point so that all the details of the event are being notified. If it fulfills the decision criteria, then it will be notified under IHR, and if it do not fulfill that decision instrument criteria, then it will be in process of consultation. That is it from my side. It is a very important topic, the international health regulation. It often comes as a short note. Okay, I have discussed it very briefly, and if you have any queries, please put it in the comment box. I would be happy to answer you.